It's a disease that impacts 1 in every 3 adults, and it costs $150 billion each year. It is also taking countless lives each year. We are talking about obesity. It has spread across the country over the past 20 years. But tonight, KSHB reveals the recent changes that is helping save patients' life and live a better life.
Well, Mark, we all try to fill our fridges with healthy choices, items that are low in carbs, high in proteins, maybe lots of greens. But doctors tell me those who are extremely obese may need a completely new lifestyle, one that includes surgery. On a routine trip to the grocery store, Brandon Johannes strolls down the aisle with ease. What's the soup of the day? But the simple task of walking wasn't always so easy.
I couldn't even stand in one place for more than a couple of minutes.
Brandon weighed nearly 500 pounds. In pictures, he was all smiles, but underneath,
I felt so uncomfortable and was so sad because of how I looked. You almost know that you need help, but you don't feel like there is help. But there is.
In February of 2011, at age 32, Brandon met bariatric surgeon Dr. Niazi Salim at the University of Kansas Hospital. He explained the severity of Brandon's obesity.
Patients develop heart disease. Patient develops increased high blood pressure, stroke, infertility, arthritis. Every system in the body gets affected.
He describes obesity as a pandemic. In 2008, the Center for Disease Control said obesity-related costs in the U.S. were nearly $150 billion. Individually, obese patients spend about $1,500 more than the average person a year on health care. Dr. Salim's solution? Surgery, which he says more and more insurance companies are paying for because the cost of leaving the obesity untreated can be much more expensive.
The expenses on medications related to the diseases, if you treat diabetes, high blood pressure, cardiac issues, depression, and so on, you will spend more money than if you spend it on morbid obese surgery.
This is his lap band.
Brandon had surgeons place a lap band on his stomach to help with portion control.
The whole idea is the food to stay above the band and trickles through the band.
So what happens after surgery? Well, Dr. Salim says 85% of patients will be diabetes-free. 75% won't need to take high blood pressure medication, and 65% will no longer need a breathing machine. But this magic band is no magic wand.
It is by no means a diet. It is a new way of life.
So long bread and pasta, hello chips and cheese.
The key to the whole thing is moderation.
2 spoons of shredded cheese, 5 chips, and a few sips of Gatorade. That's Brandon's lunch.
2 weeks worth of food for 20 bucks.
His new grocery list is saving him money and saving his life. 2 years after surgery, Brandon is down nearly 250 pounds.
I have worked and continue to work very hard at what I'm doing, but there's help. And it can and does get better.
Now, Brandon is now back in college at KU and one day hopes to work for the University of Kansas Hospital. The hospital, Mark, he says, saved his life.
You can see that. He looks so good, and it's nice to see that. It's got to be a big impact on their emotions, too, though, hasn't it?
Absolutely. There is a huge psychological element to these types of surgeries. In fact, it impacts the mind just as much as it impacts the body. And anyone who's interested in these types of surgeries needs to sign up for these social groups that will help them through the process. We put all sorts of information on our website, kshb.com.
All right, good story. Good to see him doing so well. Thanks, Sayed.